Welcome to the Human Momentum Podcast. I'm your host, Erik Schabert. I created this podcast to leverage 12 years of osteopathic medical training and over a decade of experience in primary care medicine to help sort through the confusing and often contradictory health information found on the internet. I want to distill all this information down into a form that you can use every day to optimize your health as you move forward through life. So if you are looking to get to life's finish line with the ability to do all the things that you love intact, then this podcast is for you. If this is your first time here, please don't forget to smash the subscribe button and throw us a like as well. I'd also love it if you would share this episode with people in your life who you believe can benefit from it. It really helps us get this information out to more people. With all that said, let's move on with today's episode. Welcome to the Human Momentum Podcast channel. Thank you so much for joining me in my first full episode of the 2026 podcast season for me. Today, I would like to invite you to go down a bit of a research rabbit hole with me and revisit the issue of vaccines and autism. I was pushed back onto this topic by a video I came across of an interview on the Kim Iverson podcast channel. It was an interview of a self-described independent researcher by the name of Matthew Cormier. I want to start out by saying that, number one, I very much appreciate Miss Iverson's podcast channel. She has a general viewpoint that is very critical of the establishment in politics, medicine, and finance. This frequently does lead her to propose some pretty helpful and good ideas. Mr. Cormier's research, I don't think falls into that category, and I'm going to describe why. I simply think he has misinterpreted the research that he pulled together. Basically, this particular interview was discussing a paper that Mr. Cormier produced that reviewed some of the available research on autism, viral infections, and vaccines, and basically developed a hypothesis that I disagree with. The hypothesis, quite simply, is that children in large scale are contracting viral infections in utero or in very early childhood. And then when they receive vaccines, these infections are being reactivated. And when reactivated, they produce encephalitis. That is an inflammation of the main parts of the brain, the parts that develop thought and all function in the brain. And from this inflammation, brain damage occurs that results in autism. That is his hypothesis. And I'm going to dissect that a little bit and see if we can't come up with a hypothesis that's more consistent with the full body of available medical and scientific research on the topic. Let me also start off by saying that I am not a medical practitioner that believes, as a now minority, I think, of doctors in medicine believe, that the entirety of the increase in autism rates we have seen over the past 50 years or so can be explained by changes in diagnostic criteria for autism and changes in awareness of the diagnosis by parents and teachers and medical practitioners. I don't think that's the case. I think that does account for a large chunk of the increase we've seen, as 5 times now in the past 50 years, we have expanded the criteria for what we call autism spectrum disorder. And that certainly has resulted in far more kids being diagnosed than were previously without an actual increase in the incidence of autism spectrum disorder. But to be clear, I think that only counts for around maybe 75 to 80% or so of the increase in autism incidence that we've seen over the past 5 decades. I think there are environmental factors, different exposures for women during pregnancy and exposures associated with premature birth that are driving this increase. I covered this in a previous video, and I will link that video in the description of this one. So if you would like to go back and get my thoughts on what I think is actually driving the increase in autism diagnoses over the past several decades, I cover it very thoroughly in that video. I also am going to put a link to Mr. Cormier's paper here. So if you want to go through and start pulling up the individual bits of research that he had in there that I waded through for several hours, you feel free. Okay, so let's check out this clip of Ms. Iverson's interview with Mr. Cormier, introducing the idea of what he thinks is going on.
From my understanding, your research pulled together, so you were not conducting like your own clinical trial or anything, but you were looking at research that's been done and kind of bringing it all together and analyzing it. Is that right?
That's correct. That's correct. The goal of my research was to identify the variable or the variables on what creates susceptibility, hypothetically speaking, from vaccines triggering autism.
That clip makes it clear to me that Mr. Cormier approached this research with the idea in his head that vaccines were somehow causative of autism spectrum disorder. And so he approached this not really with an open mind, well, maybe it's this, maybe it's something else, but it absolutely is this. How do I make that link plausibly? And I think that does inform on his approach to this particular research. I have my own biases as well. As a clinical practitioner, I am very hopeful that vaccines generally will be found to have good safety profiles because I see how effective they are. And I have seen firsthand how horrible the diseases they prevent can be. Particularly during my career, I saw a lot of rotavirus, a lot of shingles, and a lot of influenza causing death and disability in otherwise healthy individuals. And that is something I don't want to see happen. I'm very emotionally invested in that. And as a result, I do tend to see something like Mr. Cormier's study, and I'm looking at where the flaws are. So take my biases into account as well. But I think if you evaluate what I'm doing as an overall gestalt of scientific evidence, it comes up with better credibility than Mr. Cormier has. All right, let's look at this next clip where Mr. Cormier discusses a little bit more of what he's thinking is going on causally.
So one of the big ones that I kept coming across in my research was herpes simplex. That virus is implicated in multiple different studies as playing a major role in causing autism by getting into the brain.
So what Mr. Cormier is saying there is that he was finding evidence that research studies had implicated HSV2 infections in the central nervous system as potentially causing autism. To be clear, where we have seen evidence of that is when women contract primary HSV2 infections during pregnancy, and that infection is passed on to the child in utero, not something that happens all that often. We have seen that be implicated as a potential cause for autism. He is trying to draw an even stronger link here, and he is saying that HSV2 reactivation during childhood causes encephalitis, which goes on to cause autism in that child. And that is something that is much less supported. One of the things that I would like to make clear is that we do have solid evidence that whatever it is that is causing autism happens during fetal development in the overwhelming majority, if not all cases. This means that we have to have a trigger that occurs in the womb. And that is not something that commonly happens with herpes simplex virus, either type 1 or type 2. Really, it only happens when a woman has an outbreak of primary HSV during pregnancy. And that is something that's actually quite rare. We think 85% of cases where there is vertical transmission of HSV from a mother to a child occurs due to viral shedding during delivery. So it's happening after autism would typically develop in the overwhelming majority of kids. And as a result, it's a little hard to make the kind of link that he's saying. Additionally, we do actually have a pretty effective way of preventing it. Number one, if we can get women not to engage in risky sexual behavior during pregnancy, that can help prevent this sort of thing. Also, if we can identify when a woman has a partner who is positive for HSV2, that can also help as counseling her not to have intercourse during pregnancy with a partner who has a known infection is also helpful. And if we can identify a woman who either has a known HSV infection or is at risk for it, we can do antibody testing and, if necessary, treat with antivirals like acyclovir and valacyclovir starting at 36 weeks of pregnancy, when these medications will suppress viral shedding and therefore prevent transmission of the infection to the child. All right, so let's look at the next clip here.
Something really significant that I came across in my research when we talk about prevalence rates and the rates of viral infections. So herpes simplex type 2 is a documented risk factor for having an autistic child if an outbreak occurs during pregnancy. The prevalence of herpes simplex type 2 around the world is about 13%. So 13% of people are carrying herpes simplex type 2. There was a really, really important study that came out examining autoimmune antibodies in the brain in children with autism versus a healthy control group. And what the researchers found was that in the autistic group of children in this study, 65% of them were carrying antibodies for herpes simplex type 2. Not only that, they were carrying IgM antibodies, which indicates active or acute infection. So the global prevalence of herpes simplex type 2 is 13%. In this particular study, 65% of the autistic children were carrying herpes simplex type 2.
The study that Mr. Cormier is referencing in that clip is a 2009 study that looked at a fairly small number of kids. I believe it was only 48 or so. And these were kids, half of whom were autistic, half of whom were not, that they drew blood on and compared herpes simplex virus antibody levels and found a vastly higher rate of positive antibody levels, including IgM, a very short-lived antibody that is usually only present in acute infection in the autistic kids. This is obviously a very compelling result, and it is something that is still referenced if you search medical literature about herpes simplex virus 2 and antibody levels. Now, the problem with it is we had repeat research after the fact trying to confirm that result. And in all three of the studies that I found, the result was the opposite, that there was no difference in antibody levels between autistic children and children without autism. And the next problem we have with the hypothesis, even looking at that antibody data, if it were true, in order for herpes simplex or other viral reactivation causing encephalitis to be the causative pathway that leads to autism, and that would need to be happening in childhood, we would see a lot more hospitalized kids than we do. Viral encephalitis is not a subtle event. We're not talking about a subclinical. Subclinical means there's an infection going on, but it doesn't really produce significant symptoms that we can see right away. That's not the case. We're not talking about a kid running a low-grade temp and maybe getting brought to their pediatrician. We're talking about a very sick child with a very high fever and numerous other symptoms that would be incredibly worrying to a parent and would result in kids being brought to the emergency room. And I can tell you, as somebody who trained at one of the busiest hospitals with one of the busiest pediatric emergency rooms in Orlando, that we simply do not see encephalitis occurring at a rate necessary to explain the amount of autism we see. We are seeing, as of 2023, I think was the last year we had data, and we were seeing 1 in 31 8-year-olds being diagnosed as having autism spectrum disorder. Compare that with the volume of kids with encephalitis, and you get a vastly smaller number. Even looking at the rates of HSV infection of newborns, HSV 1 and 2, we're talking about 15.7 per 100,000 births, a far smaller number than the number of kids with autism. By the way, research does show that encephalitis is possible with reactivations of herpes family viruses. Herpes zoster is the one that most frequently does this, but we also see it with HSV1 and HSV2. Herpes zoster, by the way, is the virus that causes chickenpox, also the virus that causes shingles. They are one and the same. But the rate of any of these being reactivated and causing encephalitis is very low. Even a study referenced by Mr. Cormier in his paper only found 10 cases over a 20-year period. And that brings us on to contradictory research that Mr. Cormier does not address at all in his interview. The first of this is the fact that in response to the anti-vaccine movement, we have had multiple large volume studies with hundreds of thousands of kids in them and thousands of unvaccinated kids, comparing the rates of autism for vaccinated children to unvaccinated children. These studies were done in the United States, in Denmark, in Germany, in Australia, in Japan, and multiple other countries. And in every single one of these, it was found that the rates of autism in unvaccinated children are identical to those in vaccinated kids. If vaccines were in any way causative, this simply would not be the case. And these studies are all much larger and much more well constructed than any of the ones that Mr. Cormier referenced in this paper. Additionally, we have the population-based numbers on what rates of vaccination have been doing over the past 20 years or so, and what rates of autism are doing over the same period. And what are we finding? We are finding more and more unvaccinated kids. And the proof of that is in the measles and pertussis outbreak we had in the United States this year. We do not see those if vaccination rates are high. And yet, despite that, we are seeing climbing rates of autism. So if we're vaccinating a smaller percentage of our kids, but a higher percentage is getting autism, doesn't that argue that the vaccines aren't causative? Well, when it comes down to it, the reason I am so passionate about this is because I really would love to see the cause of autism spectrum disorder found. I have a nephew who is on the autism spectrum. I certainly would absolutely love to see an answer to this question, a rather definitive one. I think we are seeing research that is starting to give us some of the potential answers. And another good source for this, there is a vaccine researcher, Dr. Peter Hotez, who I will grant you is a very controversial figure and not popular on the political right now, because he was very supportive of lockdowns and vaccine mandates during the last pandemic. That said, he is a prominent vaccine researcher who has done, as far as I can evaluate reading his research papers, very good quality science, who has himself an adult child with moderate to severe autism. So he is somebody who is emotionally invested in answering this question. And he is plugged in with groups and discusses in a book he wrote about his daughter called Vaccines Did Not Cause Rachel's Autism. He discusses evidence that there are more than 100 genes that, when some combination of these genes are activated, cause autism. The activation of these genes occurs in utero during fetal development. And there are environmental factors they've identified, exposures of a mother and fetus, that seem to be able to trigger these genes. And some of these, just listing a few, include the medication Depakote, an anti-seizure med that is contraindicated in pregnancy. But women of childbearing age who have seizure disorders will sometimes be on it and not realize they're pregnant in time to stop the medication without exposing their fetus. And there are numerous other environmental exposures, many of them toxins, that have been implicated in activating these genes. We also know that elevated blood sugars in pregnancy, and we also know that premature birth can activate some of these genes and inhibit neural development. So again, my desire is to see the actual causes of autism elucidated without interfering with mothers and parental access to vaccines that can protect their children. I really strongly believe that we are going to be able to find ways to reduce rates of autism in this country. And we're going to do it without causing a big jump in preventable illness. If you found this video helpful, please do like, subscribe, and share. It really helps me invest the kind of time I need to invest to pull together this kind of information and make these sorts of videos and push out this content. If you have other topics you'd like to see me discuss, please do fire away in the comments section. I read all my comments, try and respond to as many as I can, and I will be happy to make more videos based on content you'd like to see. Thank you so much, and I'll see you in my next video.